and to allow Democrats to have some sort of moral high ground on this issue because they're the only ones talking about it, I think is a major failure from the Republican Party. And I'm not going to stand there and just keep talking the talking points when my own adult children can hardly afford health insurance premiums, when everyone in my district, it's the number one issue that I hear about day in and day out, not just people on the ACA, but people that have private insurance as well.
Hi, my name is Dr. Rubin, and Marjorie Taylor Greene is actually not wrong in this case. Republicans, by doing nearly $1 trillion in cuts through the One Big Beautiful Bill, is not fixing healthcare. It's just breaking it and running away and trying to put blame on other people. We are in big trouble with what's going to happen over the next few years from this bill, because nearly $1 trillion will be cut to Medicaid, and that affects everybody, not just those who rely on the social safety net. Hospitals will start to close because they rely on that funding, especially in rural communities, which will end up increasing the ER wait times in suburban and urban hospitals. This will put an overburdened stress on an already strained healthcare system. People will burn out and start to leave medicine early on, and there's not any incentives, to be honest, for medical students to come out and work in primary care when they've accrued hundreds of thousands of dollars of debt, and it's already seeing that the federal loans are being capped way below what the actual cost of medical school is. So you're going to see less people coming into primary care because they simply cannot afford it. This is not a sustainable system by making these severe cuts. We need to get back those subsidies that have expired through the Affordable Care Act, and we need to find ways to reform and control on some of these administrative costs, like the facility fees that we see in hospitals. There's just a bloat of administrative fees in insurance companies that get passed on to everybody that ends up causing significant harm. So I strongly encourage Democrats and Republicans to get back to the table to restore some of these funding cuts and then find ways to reform healthcare that is beneficial to everybody.